Post-operative patient suddenly becomes restless, pale, and tachycardic. What should the nurse do first? A. Administer the prescribed analgesic. B. Assess the patient's airway and breathing. C. Notify the physician. D. Reassure the patient. Correct answer is B. A nurse receives reports on 4 patients. Which patient should the nurse assess first? A. A patient with a temperature of 38.2 degrees Celsius. B. A patient reporting pain of 7/10. C. A patient with sudden difficulty breathing. D. A patient requesting assistance to the bathroom. Correct answer is C. 3. A patient receiving a blood transfusion develops chills, fever, and back pain. What is the nurse's priority action? A. Slow the transfusion. B. Stop the transfusion immediately. C. Administer an antipyretic. D. Continue the transfusion and monitor closely. Correct answer is B. 4. Which finding in a patient with diabetes mellitus requires immediate intervention? A. Blood glucose of 180 mg per deciliter, 10 mmol, L. B. Increased thirst. C. Blood glucose of 42 mg per deciliter, 2.3 mmol, L. With confusion. D. Increased urinary frequency. The correct answer is C. 5. A nurse discovers that a patient has received an incorrect medication. What should the nurse do first? A. Complete an incident report. B. Notify the nurse manager. C. Assess the patient for adverse effects. D. Document the error in the patient's chart. Correct answer is C. 6. A patient with a tracheostomy suddenly becomes cyanotic and has difficulty breathing. What is the nurse's priority? A. Remove the tracheostomy tube. B. Assess for airway obstruction and suction if indicated. C. Give the patient oral fluids. D. Place the patient in a supine position. Correct answer is B. 7. Which patient should be seen first in an emergency department? A. A patient with a closed ankle fracture. B. A patient with severe abdominal pain for 3 hours. C. A patient with chest pain, diaphoresis, and shortness of breath. D. A patient with a mild headache. The correct answer is C. 8. A patient taking digoxin has nausea, visual disturbances, and an irregular pulse. What should the nurse do? A. Administer the next dose. B. Hold the medication and notify the prescriber. C. Encourage increased fluid intake. D. Give an antiemetic and continue the medication. Correct answer is B. 9. A patient has a potassium level of 2.7 MEq, L, 2.7 mmol, L. Which finding is most concerning? A. Muscle weakness. B. Constipation. C. Cardiac dysrhythmia. D. Increased thirst. Correct answer is C. 10. A patient who has had a stroke is having difficulty swallowing. Which action is most appropriate? A. Give thin liquids first. B. Encourage the patient to eat quickly. C. Keep the patient NPO until swallowing is evaluated. D. Place food on the affected side of the mouth. The correct answer is C.